Stroke only causes pain in about 10% of the time. 90% of the time, there is no pain associated with it. It's a painless condition. Again, it's important to recognize that because you don't want to ignore when someone is having a stroke because they're not having pain. When we talk about a stroke, there's really two different categories that we talk about. One is ischemic strokes and the other is hemorrhagic strokes. Ischemic strokes are blood clot strokes. So essentially a clot forms, blocks blood flow past that blood clot, and as a result, the brain tissue that was supplied by that blood vessel slowly dies off. And as a result, all the functions that brain tissue controlled no longer exist. So for example, if that part of the brain controlled somebody's speech, they lose the ability to speak. If they control their ability to move their right arm, they won't be able to move their right arm. On the other hand, a hemorrhagic stroke is kind of like a burst pipe or a burst blood vessel. And that is when a blood vessel bursts, blood flows out of the blood vessel and into the brain tissue, and again, pushes on the brain tissue and causes similar symptoms that an ischemic stroke would. It's really important to follow up with your primary care physician to make sure that they're keeping up with your blood pressure, they're keeping up with your cholesterol levels, they're keeping up with your overall health. There's a lot of different factors that contribute, and the closer you follow those and the closer you manage those, the lower the risk of a stroke. So questions you should probably ask your doctor are what your risk factors for stroke are and how you can reduce that risk. So there's modifiable and non-modifiable risk factors for stroke. The non-modifiable risk factors are things you can't do anything about, including your age. The older we get, obviously, there's a higher risk of stroke. Your ethnic background, your genetics, those are things you can't do something about. But there are a series of modifiable risk factors, and those are the ones that we should be targeting. The number one modifiable risk factor is high blood pressure. We call it the silent killer because a lot of people don't have symptoms associated with high blood pressure, but it's the biggest risk. In fact, it's about 50% of your stroke risk. If we could eliminate high blood pressure in the country, we'd reduce strokes by 50%. After that, diabetes, smoking, high cholesterol, sleep apnea, atrial fibrillation, and a series of other potential risk factors. Outside of seeing your doctor and medications, lifestyle is a huge factor in reducing stroke risk. This includes not just diet, but also exercise. So doing at least about 30 minutes of cardiovascular exercise per day significantly reduces your risk for stroke. In fact, there's a lot of medications that we give patients that are not as effective as that cardiovascular exercise. So while it might seem like just a simple request from a physician, it actually is much more effective than a lot of the medications that we take. Let me try to debunk the three biggest myths that I see in stroke. The first one is that stroke is exclusively a condition of older individuals. In reality, stroke can happen to anybody. We see children as young as 6 months old having strokes for different reasons. We see teenagers having strokes. We see middle-aged individuals and older individuals. There's different reasons that they have strokes, so it's not all the same cause. But that becomes a big issue because a lot of times when younger people are having strokes, people ignore it, thinking that's not possible. So it's very important to recognize that anybody at any age can have a stroke. Probably the second biggest myth that I see about stroke is that it's a painful condition. Stroke only causes pain in about 10% of the time. 90% of the time, there is no pain associated with it. It's a painless condition. Again, it's important to recognize that because you don't want to ignore when someone is having a stroke because they're not having pain. And then finally, and the most important, which we've been working on as far as a public health program, is really showing individuals and expressing to individuals that there's a lot that can be done when someone's having a stroke. So when someone is actually having the stroke, suffering from a stroke, if they get to the hospital in time, there are many different treatments that we can offer. After a certain amount of time, however, when the brain tissue is dead, there's nothing that can be offered. So it's extremely important to call 911 immediately as soon as someone is having stroke symptoms. Every minute you're losing about 2 million brain cells, so the longer you wait, the worse the outcomes are.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate Health videos.